Hi everybody, welcome to Physio Your Body in my channel. This channel is created to provide some general guidelines on how to manage common physiotherapeutic conditions. Please remember, this is not to replace a medical advice, and always consult your doctor before you conduct any treatment or self-treatment. Today we are going to talk about basic physiological function of human, which is breathing. In particular about lateral breathing during exercises. There is 20% of oxygen in the air, so we must make sure that we make maximum out of it. Many of us smoke, have a sedentary lifestyle, so it's very important to know what is correct breathing technique. But before we start to talk about lateral breathing, just a quick recap on physiological breathing. When you make a breath in, your diaphragm flattens, your ribcage expands, allowing the air to go in. When you breathe out, your ribcage relaxes, diaphragm becomes dome-shaped, and it forces the air out. Except the diaphragm, of course, there are some other very important muscles, which are your intercostal muscles, the ones which are between your ribs. They're helping your ribs to expand and contract when you breathe out. Besides our main breathing muscles, we often use also accessory muscles. These are your sternocleidomastoids, your deeper neck muscles like scalene. These could be your upper trapezius and even your serratus anterior muscle and your latissimus dorsi. In the normal physiological breathing, we should not really use these muscles. These muscles are designed to help us breathe in a very stressful situation. For example, when we are grasping for a breath. Exercise is one of these stressful situations. That's why we need to learn to breathe correctly during exercises in order not to overstress our accessory muscles. If we do so, and if we overuse our accessory muscles, we might start developing very strong pains around our neck area, we might get some headaches, and even some backache if you use a lot of your latissimus dorsi for helping you to breathe. Before I go to lateral breathing technique, I would like to mention stomach breathing. Many of you have heard about it, and it's a great technique for relaxation. But when we exercise, we cannot relax our abdominal muscles, otherwise we might get back injury. We really need to keep them tight. So this is why we need to use lateral breathing, where we redirect breath into the sides of our lungs. In order to practice this as a separate exercise, we will need to use a simple belt. So you take the belt and wrap it around the bottom of your lungs. Cross it and tighten it a little bit, but not too tight. Think about breathing through a straw and slowly fill the bottom of your lungs with air. Think about the belt expanding and your lungs are pushing it apart, and then relax. Make sure that you're not tensing up your shoulders, your chest is not going too much up. Think about breathing through a straw. Breathe in, let it expand, and breathe out. Take your time to practice it. You can practice it in standing and sitting. You can even lay down. This is a great technique for people who are stressed and generally have a stress in their life. I give it to many of my patients just as a separate exercise. But remember, it might have a contraindication. If you suffer from asthma or any other respiratory conditions, please consult your doctor before you try this. After you practice your lateral breathing and you are good at it, you can start to incorporate it in a very simple exercise. For example, you can try to do the lateral breathing and lift your arms. And then down. You can try to do a simple squats, any simple exercise. And then you can slowly start to incorporate it in your usual exercise routine. Lateral breathing is great and simple exercise. Try it yourself and you will see the difference. If you want to know more, please subscribe to our channel, follow us on Facebook. Stay fit and be healthy.